My name is Eugene Yamamoto. I'm a physician assistant specializing in nasal and sinus care and facial plastics. So what symptoms can the VivAer help with? Nasal obstruction and difficulty breathing through the nose can be due to many different anatomical and physiological issues within the nose. If, however, you find that simply manipulating the external nose is significantly improving your breathing, the nasal valve may be contributing largely to your obstruction. The nasal valve is a common bottleneck for airflow through the nose that occurs close to the opening of the nostril and is composed of soft tissue and cartilage of both the sidewall and central dividing wall of the nose, the septum. With this bottleneck being just millimeters in width, very subtle and minimal improvements can make a substantial difference in nasal patency. So what does the VivAer do? Traditionally, nasal valve treatments can be fairly complicated and invasive. More conservative methods with adhesive and tape can be impractical for public and routine use, and sometimes uncomfortable or intolerable. VivAer provides a non-invasive, safe and quick procedure to provide subtle improvement to the nasal valve. Radiofrequency ablation is the use of precise depth and temperature-controlled heat to treat the soft tissue and cartilage of the nasal valve to remodel the narrowing that occurs. By tightening the soft tissue, remolding the cartilage, and promoting collagen formation, this procedure can not only widen the valve without changing the external nasal appearance, but also strengthen the sidewalls to reduce inward collapse. So how is the VivAer performed? This procedure is performed minimally invasively, requiring no incisions or removal of any tissue within the nose. The nose is numbed using topical anesthetic and injections prior to the ablations. All medications and packing are removed from the nose once the procedure is completed, and the patient can then return home. So, what can patients typically expect after the VivAer procedure? Patients may rarely experience some temporary external nasal swelling and also scabbing and crusting just within the nostril. We recommend routine use of nasal saline mist within the first month of healing, and also application of ointment within the nostril for the first few weeks to help with healing. Activities are otherwise unrestricted following the procedure, with the exception of any aggressive cleaning or removal of scabbing or crusting within the nose. Results are expected to be seen anywhere from 4 to 8 weeks from time of procedure. For any further information regarding the VivAer or to schedule an appointment or evaluation, please contact our office and our staff will be happy to assist you. Once again, my name is Eugene Yamamoto and I'm a physician assistant who will be happy to help you with your nasal and sinus problems.